Well, joining us on the program now is Dr. Alyssa Doom, and she's with Physicians Hearing Services. Thanks for joining us this morning.
Thanks for having me.
Physicians Hearing Services, it sounds like a big group, and you actually have quite a few doctors over there as well, don't you?
Yeah, we have 11 audiologists and 4 current interns right now that are training to be an audiologist as well. So very large group, and we support about 9-10 ear, nose, throat physicians as well.
Very good. So when someone comes into your facility and they, take the hearing test, do they all get the same hearing test?
Right,
Pretty much to get things going?
Yeah, definitely. They're a basic audiologic evaluation. So we're going to test the hearing, we're going to check the middle ear and the inner ear, so different components of the ear just to check for underlying pathology. Is it an ear infection or is it a neural, the nerve itself due to aging has gradually declined. So we're kind of trying to check out, put the pieces together and determine what actually is the underlying cause.
Right. And like you said, it's gradual, so people don't realize it. So by the time they probably come into your office, they've had quite a bit of hearing impairment for many years.
Yeah, that is the case for quite a few patients.
So what is the middle ear and the inner ear? What do they do? I imagine they have different functions, obviously. But
definitely.
What do they actually pick up?
Yeah, so the outer ear, we would consider the canal just going down into the ear. The eardrum and then the little ear bones right behind is called the middle ear. It's all a part of, as the sound waves are hitting it, that's really what's causing those sound waves to get to the inner ear, which is what's processing it. That's where the nerves are housed. And so that's really where the conduction of the sound into essentially the nerves that are going to take it to the brain are housed. As
people age and they, our community especially, the pools are very popular, they go swimming. Do you have, people have issues with hearing, with their hearing drum and with pressure? Is that usually a common cause here in our community?
Yeah, definitely in the Southern California community. A lot of surfers, so we see a lot of surfers' ear, swimmers' ear issues, and that would be more of a pathology, a medical issue as far as, a temporary hearing loss that typically will go away with treatment. And then, the more permanent hearing losses are typically not affected with the swimming and everything like that, but it can, with long-term use, harden the eardrum and then cause some conduction issues for the sound.
Well, what kind of medical advancements do you see coming here? And I would imagine in the last 10 to 15 years you've seen quite a few, but I can't even imagine what's going to happen in the future. What kind of advancements have you seen in your time there, and what do you see for the future for medical devices, things like that?
Yeah, exactly. So in the future, well, in the past 10 years or so, there have been a lot of advances as far as hearing devices go. They're miniaturizing, so of course everything's getting more cosmetic, smaller, more invisible. Also fun, so we can match the hair color, the ear color, things like that as far as the devices go. So they're not just kind of the ones you would see 15 years ago, the big honkin', doesn't really match anything thing on the ear. As far as that goes, also with the smaller miniaturization of the devices, they're now digital versus analog. So instead of being a simple amplifier where everything is being boosted the same, they're actually programmable per person. So it's very customizable, fine-tunable for that person's specific hearing loss and hearing needs.
Right, so it's not like the old days when you were in a busy restaurant and you just hear room noise, and as you turn up that hearing aid, the little knob, it just makes the other noise just as loud as well, right?
Exactly. We've improved upon that tremendously.
Right. I think it's interesting. I don't know if anybody watches the popular show Survivor, but one of the contestants this year is completely deaf. So, it kind of tells you about the challenges that she faces socially, but you can imagine being on an island with 8 people that are trying to kick you out anyways, and she cannot hear. So it's interesting to see the challenges that she has and kind of the information that brings out, as far as helping people like that. It's quite difficult. Let's talk about the big box stores. It seems like they're kind of getting into the hearing device business as well. What kind of is the difference when you go to the big box stores than maybe someone comes to Physicians Hearing Services?
Right. Several differences. I've already pinpointed as far as kind of the medical model that we like to provide, so that we are checking the underlying issues that may or may not be medically managed before putting a hearing device on the person. Versus the big box, they're screening the hearing. They're not really trained to check for any underlying issues. If there is a deeper issue, would they catch it? On top of that, they're kind of making it a one-time exchange. It's a purchase. This is, here it is, go use it. versus someone at a medical clinic or office like Physicians Hearing Services. We like to go that above and beyond. It really should be a service model.
Right.
So on top of the medical model itself, but a service model, because devices aren't, hearing devices themselves aren't just a one-time purchase, you're good to go. Mm-hmm. It really is a brain thing. So what I mean by that is, as the patient is getting used to the new sounds they haven't heard in a while, we do need to be very gradual with our settings. So we're taking real ear measurements of that person's individual ear and how it responds to sound. We're making sure that we prescribe the settings according to that person's specific hearing loss. And then proper follow-up. Mm-hmm. So it's kind of like a car. You would go and have an oil change. Same thing with these. They need fine-tuning and cleanings and just regular maintenance every couple of months, as well as adjustments as the person's hearing is changing, or if they're in a specific environment where maybe, let's say, they have a lot of noise issue, like a restaurant, then we're going to program a certain program so that when they're in those environments, they can take advantage of noise suppression and things like that, to per environment. So the hearing isn't going to be the same each time, each place. Exactly.
Right. And that's why it's important. I mean, the name says it, services. So you're there to provide a service, obviously, and you're obviously going to give them the right appliance that they're going to need. Correct. And if they go to some of these big box stores or even the small box stores, the next time you go over there, they could be closed down, and then you're out of luck. So it's very important that to have someone that has reliability and loyalty too.
Of course.
Let's talk about credentials, because obviously services is very important. And what kind of credentials should someone be looking for when they go and visit someone like yourself?
Yeah, definitely. So the kind of the end-all be-all in the hearing and hearing aid realm is a doctorate of audiology, or an AUD. So that's the degree that I hold. I'm an audiologist. As far as the credentialing goes, we're doing 4 years of undergraduate. We have our bachelor's. On top of that, we're going an extra 4 years in a graduate program for doctoral level credentialing there. So 8 full years of schooling, clinical, rigorous clinical practice, and then even a full year internship before we're awarded that doctorate.
Wow.
So I mean, we know our stuff as far as that goes, and we're also just staying abreast. It's a requirement that we have several hours of continuing education per year. So not only are we keeping abreast with the best practices clinically, but we're also keeping abreast with any new technology that's out there, any of the main hearing aid brands, and so we're keeping abreast of all of that.
So that's why it's important. Even though you might be sitting in the lobby and wait for a little bit, you see all these beautiful certificates around. Yeah. You think, well, that's nice, but it's really important that you see those, and that that's important information that shows that you've gone through the process and you've gone through the schooling to provide the services that these people expect, right?
Yes, definitely.
Where'd you go to school at?
I'm actually from Arkansas originally,
Wow.
So I went to school at a private college there for undergraduate, and then University of Arkansas for medical sciences in Little Rock for my doctoral degree.
So you're a Razorback.
I am.
Great. What brought you out to California?
The job.
There you go.
Yeah.
That's great.
And the weather, I mean, come on, you can't beat
Absolutely. Can't beat the weather and the people
right.
out here. It's incredible. And that's what's interesting about Southern California. I think we are an active, society here in Southern California. People bike, swim, surf, do different things. Exactly. So, they will need some, help with their hearing and things like that in the future. So, especially if they're swimmers. So, it's really important that they go. Do you suggest that people come in once a year? You visit your dentist, but there doesn't seem to be like, hey, come see your hearing specialist once a year, twice a year?
Right. So brand new patients typically are coming in when they've noticed something's awry, either physically, outer swimmer ear, or a gradual hearing loss that they've noticed, and they say, well, it's just time, we'll go check it out. Right. So after that baseline exam, typically it is annual or biannual that we want to keep checking that hearing, making sure the progression is tracked. And then of course, if it is to the degree that it needs a hearing device, because not all hearing losses are to that degree,
right.
But once they get to the point where they do need help, we definitely like to keep watching the progress of the hearing, and then as it's changing, the devices, like I said, they're digitally programmable, so we're actually going in and adjusting them slightly, tuning them as the hearing is changing as well. So it's very customizable. As the hearing is changing, it grows with them.
Yeah. Do you find spouses bringing their spouse in? Because
all the time.
I would imagine, because usually the person that's hearing the hearing loss, they've already adapted to it. They're like, you have a problem, I'm fine. I have a good friend, his father was like that, and then he also thought, well, it's a stigmatism too about, you know, wearing an appliance like that. And he was so stubborn about going, but all the family functions, every time he was left out of the conversation. You know, you had to say things over and over to him, and finally they got him to go see somebody. But that it's really important that, you know, if your spouse is kind of like encouraging you to go see someone, they should go see someone like yourself.
I would say so, yeah. That's a lot of our patients as far as that goes, yeah, in any age range, young people up to elderly, you know, geriatric patients, spouses and children are often the ones who are kind of nudging them in the door. And you know, no one wants to hear that they're aging and getting older, so of course I see the resistance there as far as that goes. But generally, once we get you in the door, we can get you pretty happy and pretty successful. So it really, most of my patients will come back and say, you know, I'm really glad that my daughter or my husband nudged me, because I'm definitely happier now. I can tell the benefit. Right,
and that's why it's important to go see a professional and go see someone like your offices, because you've been there a long time. You have many doctors that can work with many of the patients, and you just have that, you know, comfort that, you know, someone's going to take care of you. So, and it's not like the old days, like we had talked about. You have this, you know, big hearing aid, and that's what people don't want to have. But now they're small in the ear, depending on your level of hearing loss. That will work out just fine for everybody.
As they're getting more cosmetic, they're definitely the stigma isn't quite so you know, noticeable. And people are wearing little Bluetooth devices in their ear. I mean, technology is just so different now. People like technology, so be the cool person on your block, get the devices.
The Bluetooth devices, I guess, that at first everybody thought they were like on Star Trek. You know, so it was cool, but you know, back in the 70s and 80s, it wasn't cool because it was a hearing device. So, you know, things change, and especially technology is helping with that. Well, thanks so much for joining us today on the program. That's great information. Physicians Hearing Services, be sure and visit them on their website, or give them a call at 364-4361 for all your hearing needs. We'll be back with more of the program right after this. Great job.
Thank you, Paul.
Yeah, that was easy.